Hi guys, it's your girl Eva Stone XOX. So I am just getting ready to head out to the gym. It is October 3rd, it's 5:25 in the evening. Back for another night workout. Gonna go hit my last day of this week. Overall I feel a little bit better rested. Body's a little sore and achy, but that's to be expected. It's my 5th day. It's also a new program, so my body's adjusting, getting used to everything. So yeah, stay tuned. It's day 20, guys. So getting there, getting stuff done, happy and proud of myself. So we'll catch you guys later. Bye, lots of love. Heading out now. I'm gonna quickly enjoy a little bit of that breast protein again. I only really had one meal today. It was a nice, good, heavy meal with some good carbs for lunch today. So I am gonna fuel up with some protein before the gym, and then I'll come home. I'll have some eggs again, and then I will hit some good food. So stay tuned. It's Friday night when I'm lying down with a movie later. So yeah, I'll show you what we end up eating and all that fun stuff. So later. Alright guys, ready to start day 20 of this workout, so we'll catch you guys in the gym. See you in a bit. Anytime Fitness, back to the grind. Alright guys, so as you have known, I've been having some issues with my rotator cuff. I went to an ultrasound technician today to have a scan of my shoulder done in downtown Vancouver, and they used a special machine to do some kind of scan on my shoulder, and the technician had told me that there's actually calcium deposits in my rotator cuff, maybe from a past injury or something like that, kind of overuse or sort of something like that. Not really sure of the cause of it, but my doctor I'll still have to follow up with. But let's dive into what are calcium deposits. So calcium deposits in the shoulder, known as calcific tendinopathy, are a buildup of calcium in the rotator cuff tendons that can cause pain and limited movement. Now, diagnosis involves a physical exam or either a scan, kind of ultrasound, to confirm the deposits. Now, some treatment options range from conservative methods like anti-inflammatory medications, physical therapy, and corticosteroid injections to more aggressive options like needle leverage or shockwave therapy, and in some cases, surgery is even needed to remove the deposits. So what does it mean? Well, the deposits are a form of calcific tendinopathy, often occurring in the rotator cuff tendons. While the exact cause is not fully understood, it's linked to wear and tear and the natural healing process. So what might the symptoms be? Now, symptoms can include sudden intense pain, stiffness, and reduced range of motion. However, some people may have deposits without any symptoms at all. Now, there are 3 stages of reactive calcification: pre-calcific, then we have calcific, and then post-calcific. The calcific stage is when the body is resorbing the deposits and is often the most painful stage. Now, when it comes to diagnosing, physical exams are a great way to kind of understand what's really going on. A doctor will perform a physical exam to assess your shoulder's range of motion and tenderness. And normally an X-ray or ultrasound is needed. So an X-ray is the primary tool used to confirm the presence and location of the calcium deposits. Multiple X-rays may be taken over time to monitor changes in the deposits. Now let's dive into treatment options, guys. So let's go with non-surgical first. So you can simply try medication. Over-the-counter anti-inflammatory medications can help manage pain. There's also corticosteroid injections. A powerful anti-inflammatory injection can provide temporary relief. You may even try physical therapy. This is crucial for regaining strength, range of motion, and control of the shoulder. Sometimes even ultrasound-guided needle lavage is needed. It's a procedure where needles are inserted to wash the area with saline, helping to break up and remove the deposits. Your doctor may also recommend shockwave therapy. Now this uses sound waves to break up the deposits so the body can absorb them more easily. Now, when these methods tend to fail a patient and they struggle a little bit more with pain from the buildup of deposits, sometimes surgical ways are needed. So there's arthroscopic surgery, which is a minimally invasive procedure using a camera and tiny instruments to remove the deposits. And lastly, when all else fails, open surgery might be needed. This is an incision made to manually remove the deposits. Surgery is typically considered if conservative treatments have failed. It's sort of like a last resort to help try to resolve the pain and issues that you're dealing with. Did you know the most affected tendon is the supraspinatus tendon? That's the most common site for these deposits, followed by the infraspinatus and the subscapularis tendon. It is something that tends to affect women more frequently than men. It typically appears in people between the ages of 30 and 60. Pain can feel intense, and you can feel it deep in the shoulder or over the upper outer arm, and it often makes it difficult to sleep. Now, when you have calcium deposits in your shoulder, you should actually avoid certain movements that cause strain or pain, such as reaching, lifting, pushing, pulling, and repetitive overhead motions. You should also avoid certain sleeping positions like lying flat on your back without support and activities that put stress on your shoulders, such as some weightlifting or swimming strokes. So some of the movements and activities to avoid include the reaching, lifting, pushing, and pulling. Avoid any strenuous activity with the affected shoulder, especially for the first few weeks. Then you want to pay attention to repetitive overhead motions. These are a common cause of the condition and should be limited, especially if they cause pain. Then moving into heavy lifting. This places significant stress on the shoulder and rotator cuff, along with certain swimming strokes. Overhand strokes should be avoided. Now, when weightlifting, avoid exercises that put stress on your shoulder. Did you know that lying flat on your back can put pressure on the shoulder? Also, lying directly on the affected side. This can cause pain and pressure when you're dealing with calcium deposits. Now, some other recommendations. It's really important that you're resting your shoulder to allow muscles to recover. It also helps to sleep propped up on pillows to alleviate the pressure in your shoulder. And if you must maintain some range of motion, follow your doctor or physical therapist's specific passive exercises and avoid all movements that are causing you pain. If any pain increases or becomes unmanageable, it's important to communicate well with your doctor or physical therapist. in order to create the best treatment plan. Now, good exercises for calcium deposits include gentle movements to maintain range of motion, such as pendulum swings, shoulder rolls, and active range of motion exercises like forward flexion and abduction. Strengthening exercises are very important for the shoulder blade muscles and rotator cuff. It will be beneficial. So you want to use light resistance bands for activities like rows or external rotations. You want to make sure to perform these exercises gently, without pain, and avoid aggressive stretching or heavy overhead movements. Some of the gentle range of motion exercises include pendulum swings, shoulder rolls and shrugs. Some of the active range of motion exercises include forward flexion, abduction, internal and external rotation. But you also want to include strengthening exercises. Now these include rows, rotator cuff external rotation, and even shoulder blade exercises. It's very important to, keep your shoulder active and moving, but being mindful not to cause more pain or aggravate it. For a healthy rotator cuff, focus on foods rich in vitamin C. Citrus, berries, bell peppers, omega-3 fatty acids, salmon, flax seeds, and zinc, nuts, seeds, and whole grains. This helps to support tissue repair and reduce inflammation. While calcium is essential for bone health, it's not directly linked to the formation of these soft tissue deposits, and you should not reduce your dietary calcium intake to treat them. A balanced diet with adequate protein, vitamins, and hydration is actually very crucial for overall recovery. Now, you want to limit foods that are inflammatory, so reducing intake of alcohol, excess sugar, and high sodium foods because they can increase inflammation and hinder your healing. Alright guys, day 20 of the new program is finished. Felt pretty good. Took my sweet time on a lot of the exercises today, but definitely feeling a little bit better. So yeah, we'll catch you guys later and show you what's up for dinner. Bye! Alright guys, just gonna enjoy a little bit of eggs here to get some protein after the gym. This is my second meal today as I have really eaten a whole lot today. So just getting in this and then I'll make some dinner after my shower. So stay tuned. Now these are just a few of the different meals I've eaten in the last few days. But thank you so much for watching. I truly appreciate it. Please remember to like, follow, and subscribe to my channel. See you next time. Bye!